starts right now.
Thank you so much for joining us. I'm Josh Berry. The summer season isn't typically known for the season of sicknesses, but tonight we're on the Medical Mile in Grand Rapids focusing on your health after a potential measles exposure in West Michigan. Our Alina Howder joins us now after speaking with an expert about what you need to know. Hey, Alina.
Hey, Josh. So Muskegon County officials are warning of a potential exposure at a Norton Shores movie theater. This now brings the total number of measles cases in Michigan so far this year to 16.
A red blotchy rash, runny nose, and watery eyes are just a few symptoms of measles.
It is probably the most infectious pathogen that we work on. Just super communicable.
It's why Michigan's health department says measles should be on your radar.
I mean, this is certainly more cases in a year than we have traditionally seen.
According to Muskegon County health officials, the latest potential measles exposure happened on June 12th between 5:30 and 10:30 p.m. at Cinema Carousel in Norton Shores.
You actually don't have to be in the same place with an infected person to be exposed. You could be there 2 hours later and still get exposed to the virus because it hangs in the air for so long.
Director of the Bureau of Infectious Disease Prevention, Joe Coyle, says the virus has ramped up for our neighbors up north in Ontario, Canada.
They've seen over 2,000 cases at this point. And obviously we're nowhere near that, but they are our neighbors. It does look like they're trending downwards, which is good. But the risk of measles is real.
However, there is some good news.
I think we definitely have seen, too, an increase in the number of measles, mumps, rubella vaccines that have been administered in the state, above what we would see normally around this time of year.
He said the immunity level in the population is what's preventing a large-scale outbreak in the general community, which is why vaccines like the MMR are so important.
It's 97% effective preventing infection if you have 2 doses, and that'll keep you from getting measles and protect the community around you. So just can't endorse that enough.
So how concerned should you be if you were born after 1957 and received a measles vaccination as a child? According to the CDC, you are considered protected for life, and you do not need a booster. While still a concern, especially for international unvaccinated travelers, the CDC also says most people in the U.S. are protected.
All right, that's good to know, Alina. Thank you so much. So what should you be focused on right now? We often hear about summer surges of various illnesses, but experts we spoke to right now say we're doing okay.
Sort of traditional respiratory viruses like COVID and flu are at pretty darn low levels right now. I guess I would take it as an opportunity to say this, though. We are in the middle of fair season. Just want to make sure people know that when there are swine exhibits, especially around the summertime, we do sometimes see sporadic novel influenza pop up here or there.
He encouraged diligence in hand washing for anyone who may visit fairs, especially the animal exhibits, in particular swine, which could pose a risk of swine influenza. But these are important reminders any time of the year, no matter where you're visiting. We also talked with a local pharmacist who reiterated that summer illnesses appear to be down, though allergy and travel-related stomach issues remain prevalent.
And I think the old lessons about washing your hands, cuffing your elbow, all that kind of stuff helps, even during the summer, because that's when things are not on your mind and something like that could take off. So I think all year it's good to think about ways to not spread stuff. We don't see as much of it here during the summer, but it's good to keep on your mind the whole time.
Now, there's a new variant of COVID called NB181, and there are questions about whether it will experience a summer surge. Johns Hopkins University says every summer since 2020, cases have risen in July and August. Medical experts say lower vaccination rates and waning immunity from previous doses could contribute to a rise in cases. Right now, the new variant is not one of the dominant strains in the U.S., but experts say it is shown